As a young investigator, there's a real impasse in our field of heart rhythm disorders. So I look at atrial fibrillation, which is an irregular heart rhythm disorder, and we are not very successful at curing it with ablation. In these very unique 25 patients selected from over 200 who I screened with atrial fibrillation. So just to put this in context, these are patients who have had the disease for 6 to 7 years on average, who have got widely dilated heart structures in whom current success rates would be less than probably 40-30% with ablation. Each of these patients had the arrhythmia stop with 1 or 2 single burns. So these are kind of cases that would become case reports in journals in most hands, and I collected them and prove that actually looking at the electrograms or the signals that we record and analyze, if you use the signals to look at the atrial fibrillation in 2 methods, the classical and the computational, one method shows something you can target, which is this phase analysis, whereas the other method, which we've been using for the last 40, 50 years, would have missed 80% of sources in those patients. But mechanisms are fundamental, and that's what I'm kind of spending the next couple of years looking at Stanford and at Imperial College. In atrial fibrillation, it's been shown in animals up until 2012, and then our group showed it in humans for the first time. And what's more, we use them as targets for ablation. We're now using, or hoping, pilot studies to explore the same techniques of the baskets and the electrode kind of techniques that I presented in the ventricle to stop VFib. We can come together and demonstrate areas that we can focus our treatments on, be it drugs or ablation or stem cells or whatever comes along in the future. We can improve treatment for AFib. And we're stuck at the moment at this 50% success rate, which is really unacceptable, and we need to kind of come together as a community to move forward because our patients are suffering.